My name is Missy. I am a speech therapist. I work at the OhioHealth Rehabilitation Center on Tremont. That's one of our outpatient neuro centers. I don't know if any of you has had any experiences of working with a speech therapist, or if you're even familiar with the content I'm going to be talking about today. And I really like to keep this very casual, very hopefully interactive, and to be easier to learn it that way when you ask questions and based on your personal, you share experiences and things like that. I do have a handout, and you are able to read it on your own, so I may jump around a little bit. Feel free to chime in, interrupt, ask questions, and hopefully we will make this an enjoyable learning experience, okay? First of all, I have to say, I am so glad you're part of this program, and we are so fortunate to have this program in this area, and I think Jackie and Dave and all these people are doing a tremendous job, and I'm so glad and honored to be part of this. So, to start out with, I want to get a little bit of an idea. Just, intuitively, when you hear speech therapy, what do you think we do? Because Parkinson's is, as you know, is known as a motor disease, right? You have gait problems, and you have tremors, and it's the motor issues. Where does speech fit into this picture? When you hear speech therapy, what do you think? What do we do? And just even related to your personal experiences, what kinds of things you think that we may be able to help you with? Stuttering? So fluency, it's like a movement, the fluency of the movement. So we may have stuttering kind of like speech.
Hesitant speech sometimes for me.
Again, there's another, brought up about the speech issue, the hesitancy. So maybe the pausing, the flow, the processing. What are you referring to?
The process of understanding what you're hearing and translating that to speech coming out.
Can you hear? Can you guys hear him in the back? I've got to speak loud. We're going to be touching on this topic later on. So he was talking about maybe possibly some processing issues, the comprehension, the processing of information. We'll touch on that too. And I see a hand there.
I was going to say the volume of the speech.
Are you guys able to hear in the front? The volume, the intensity, the loudness. So we have people maybe experiencing speech, the fluency, the hesitancy, the flow of speech. We may have processing. That is a little bit more along the line, what I call it a cognition. And there's a volume. And that goes with the voicing problem. And it's also part of that speech, right? Any other problems
Anxiety in being able to communicate. I know that sometimes there's an anxiety and you have a hesitation, I guess, is another thing, but anxiety about trying to say something in a group surrounding.
The anxiety, or maybe the fear of communicating, being able to make yourself understood?
Correct.
Yeah? Okay. Any other things you think a speech therapist would do that will may be able to help you with in this process, other than speech, voice, processing? I'm hearing swallowing. I put down on the second slide some of the terminologies you may come across in your literature review. And just very quickly, to give you an idea what all these big terms, what do they mean? And I did put down some definitions. Dysarthria, it's just a fancy term for slurred speech. And the hypokinetic dysarthria, when you hypokinetic, it's just meaning the range of the muscle movement is reduced. So the tongue, the lips, the palate, the muscles within the oral cavity. That can impact the speech. The bradykinesia, it's the slow movement. Dysphagia, it's just another fancy term for swallowing problems, okay? Cognition, we have someone mentioned about the processing issue. We'll go a little bit more into the cognition. So I would put that under cognition. That's all the mental skills you will need, anywhere from your ability to maintain your concentration, all the way to your short-term memory, to your decision-making ability. Everything, anything goes into that mental skills to help you get through your day. I lump them all under, actually, language is sometimes in literature, they bunch them together, they will mention some language issues within that cognition, okay? So these are the three things. I always tell my patients when I work with them, I'm trying to explain to them what a speech therapist may do in a medical setting. And I always say we kind of look for problems from neck up, okay? So if you can kind of topographically, we may address, and especially pertaining to Parkinson's, swallowing could be one, but voice is a big issue. Someone mentioned the volume issue. So swallowing, voice, moving up, it can be chewing, it can be articulation. Like we're talking about, well, the fluency, not quite articulation issue, but this is the speech issue, the weakness of the oral muscles, the slurred speech, and all the way on the top, then you are talking about processing of language and processing of cognitive information. So swallowing, voice, speech, language, cognition. These are the three major areas we may get involved in. Now, there may be overlap with some other rehab professionals, all right? Any questions about this first slide? All right, then moving on. Let's go into each of the specific areas. The first one is the speech. There's a whole bunch, we have people mentioning about the fluency, the hesitancy of speech, and there may be people will complain about things like slurred speech, articulation issue, maybe with certain sounds or maybe with a lot of sounds, intelligibility. No, of course, that can be related to the imprecise articulation, or that may be related to the volume. If you speak very low volume, very soft, that can impact your ability to make yourself understood. The literature varies a little bit in terms of the prevalence of it. They could be saying, I put it down, 89%. That seems kind of like the middle of the road. And there can be as high as, they say like a 95% of the people may experience some version of speech, voice-related issues. Now, Parkinson's, one Parkinson is different from another Parkinson's. Everybody is different. So there's various degrees of these problems. Some people may have it very, very mild. Some people may have it very, very severe. And like any other issues that I'm talking about, it's all varies from person to person. I'm not saying that you definitely, in the course of the disease progression, everybody will have all of these issues. So please do know you may have someone that will never have any of them, or may only have one of the three, two of the three, or some people may have all of it. Does that make sense? Yeah. You guys are pretty quiet today. It's just like chilling from all the exercises, right? Yeah. Like I said, do feel free to share your experiences. Like I said, everybody is different. All the Parkinson's patients I've worked with, everybody have their own presentations, have their own unique experiences, their own personal fears, anxiety, and just everybody is different. So, and I am talking about, it's non-motor related problems today. So it's not the typical things you guys normally deal with. So do feel free, most likely, if you are experiencing something, then maybe someone else will have that similar issue as well. So don't feel like, it's just me, maybe this is something that I shouldn't be mentioning. So do feel free to speak up. And as a matter of fact, one of the things I like about this delayed disease, other than you guys are getting the physical exercises, it's this social interaction aspect, the ability to communicate, within this circle of people, then you share similar experiences. And I think that has tremendous benefit, both in terms of your speech, your voice, and cognition. So I love that aspect as well. And I see a hand there. I am not a doctor, but I know exactly what you're saying. I can see that impact. Even, say, people working, I'm jumping around a little bit, working with people with swallowing problems. One of the things we tell them to do is that, please, kind of schedule your medication, your really difficult to eat kind of food around your medication, because if you do that, if someone has swallowing issues already, and then you're eating something very tough right around the time the medication is wearing off, and you're certainly not going to be doing as well as if the medication is in full and strongest effect. So I can see that aspect, but I'm not a doctor, definitely check with your doctor, but I do see that fluctuation. Another thing is fatigue. Okay, when you are fatigued, you are not going to be doing as well. So even in the therapy sessions, I may have someone that they may do well in the first half of the paragraph, then they trail off, So that fluctuations from the morning till throughout the day, we do see that, or even within our session, we see that as well. Medication, fatigue, how you feel, how confident you are, and how your muscles are. Ultimately, to be able to pronounce, to be able to project your voice, it's muscles. Muscles are controlling, are doing the job. If they are not doing they're not moving as well, and your speech is not going to be as clear. These muscles for us to be able to speak intelligibly, to be able to project our voice, we need several systems to work together and work together effectively. So we need to have the mouth muscles to work together so you can make the sounds and position your articulators in a very precise way. We need your phonatory system. Your vocal cords will need to work well together. We need your respiratory system you got to give the power to support your speech, right? These three systems are kind of, from research, are shown may be compromised in patients with Parkinson's, okay? Like I said, I can't specifically say the extent and the reason why. Doctors probably would be able to explain that a little bit more, but we do know a lot of the times people would complain, I can't, I'm speaking one sentence, I'm running out of breath towards the end of that sentence. The breath support it can be compromised. There's some research studies that will show, the vocal cords within your voice box, how we make sounds is the two vocal cords, they need to come together, edge against edge, smoothly and together, in order for you to speak loudly, in order for your voice, for the sounds to be perceived as normal. There's some research showing there's a little bit, they call it a bowing of the vocal cords, meaning they're like, when they come together like that, and the air is let out prematurely, okay? Because normally it needs to be like that. Therefore, they're running out of breath, their voice is not as strong. Because how do you make loud voice? You gotta speak really, you gotta project, you gotta force them together, but when they're not coming together like that. And then there's also, you probably know that, depending on, not everybody with Parkinson's will have problems with drooling, but sometimes people do have that issue with drooling. The sensory awareness, sensing that there's collection of saliva, there's ability to be able for the tongue muscles, for the lip muscles to work together to be able to move them around and get the swallow going as frequently as you used to. So all of these can be compromised, and they have impact for swallowing, they also have implications for speech. Okay, all right. Well, I know I'm kind of, it's really not fit nice and neat into one slide, but if you have a question, I would rather address from that perspective, and so you can kind of get an idea, how these systems may interfere with each other and why you may be having these problems. I want to make sure that I'm sticking to my time, because oftentimes I'm going off on a tangent and there's things I want to mention that will get missed. I'm sorry, you have a question. Obviously we won't have a whole lot of time to talk about treatment. We do work with people in, I call it developing compensatory strategies. There's different avenues we address these issues. Drooling, it's really not so much that the person is producing more saliva, it's they're swallowing less. The autonomic nervous system is not working quite as well, so they're not swallowing as much as it used to. And the saliva the mouth secretes saliva anyway to help us, lubricate the oral the system and to help wash down the bacteria. It's very important. But when someone is not swallowing as frequently and the saliva it's continuing to be produced, but you're now sensing that and the lips now blocking it, the tongue is not. So we teach, one of the things, of course it's hard to mention all of them, is really trying to get them be mindful, and so they are able to volitionally, purposely to swallow more. That could be one thing. We may depending on the issue, there may be some therapeutic exercises we work with them to help them to, just like you have exercises for your arms and legs, we also have exercises for lips, for tongue, and for the mouth muscles. There may be therapeutic exercises. There may be some techniques to enhance the sensory function of the oral cavity. Something hot, cold, different taste, different textures, they will stimulate the sensory function. And that could be something that would be helpful. Now, I'm glad you mentioned this. What can we do, with all these issues? I would rather, all the treatment techniques, I'm sorry, I'm kind of backing up a little bit. All the treatment techniques and therapies, they tend to work better when the problems are more like at the beginning stage, the mild stage, versus you wait till it gets a little bit more advanced. Even like I'm going to be touching on, I certainly want to touch on this voice treatment protocol called the Lee Silverman voice treatment. That is speaker, patient-oriented, very well-researched voice treatment technique. It was developed for patients with Parkinson's. So it was really developed with the people, with the population group with Parkinson. Now, even though it has been, kind of utilized for other diagnoses, even this, this has a lot of research evidence backing up, showing the efficacy of it. Of course, granted, you have to follow, it's a very strict protocol, and the therapist will have to go through training, be certified, okay? But anyway, even that shows it's more effective for someone in more of the mild stage of it, voice, versus someone who's already talking like this, and again, you've been here a minute, when it's so advanced and so more like towards moderate and severe. So I'm glad you mentioned that when you do have these issues that we really, especially, you're getting people mentioning, asking you to repeat a lot, and you are, having some doubts about, or you're having fear of talking to family, friends, and you are having fear of eating out. You don't want to go out to eat out because you're afraid of drooling issues, you're afraid of choking, you're afraid you can't chew up certain food. Just talk to your doctor. Talk to Jackie, talk to these professionals, and they, make appropriate referral, get the therapy started early, get the intervention started early. And oftentimes, and you can, when you work on things early on, you have a better chance of being able to compensate for it more successfully. Does that make sense? The very last slide mentions who you should talk to, when you have issues. Obviously, you all have neurologists. So Dr. Hinkle, Dr. Malone, and whoever. I mean, these are all experts. And talk to your neurologist, talk to your family doctor, talk to the, people from delayed disease. And these are the people really. And then if some of the people we do see them in the clinic. And so if you're only getting physical therapy, it doesn't mean you can't mention about your speech problem. It doesn't mean you can't mention about other concerns you have, because we all work together as a team, right? And so if it's needed, we can bring other disciplines. So talk to your therapist. Talk to your family member. Talk to people in the group, and oftentimes you probably have similar experiences. Okay, let's see. Let me touch on before I move on to cognition. Any questions?
Good question.
That was a good question.
Yeah, it's kind of like a catch-22.
You're right, because especially from as a therapist, we can't say you're talking great, but since you had the diagnosis, and why don't we bring you to the clinic? Because the insurance is going to say, why am I paying for something that really doesn't exist? But if for the Lee Silverman voice treatment program I attended, they actually say from the minute the person is diagnosed with the Parkinson's, it should be referred for therapy. So right now you're in delayed disease class. You're not in therapy. You're doing things preventative in nature, right? I don't see why we can't. I mean, of course, right now speech is not part of this preventative, but I don't see why that number one, be aware of these possible issues. Two, I don't see why we can't set up certain exercises for you guys to do, even things like the voice problems, and it can be pretty prevalent. I read it last night. It can be maybe as much as like 45%. I mean, it's various versions of the voice issues. Even if you just read out loud, and one of the things we tell them to do, and part of the homework, what do? You read out loud. Why can't you do that? I mean, that's not going to hurt anything, right? And that will continue to keep things, and you being very mindful, you're monitoring that. Is the volume decreasing as the years go by? So there are things in my mind that you can do preventatively. People coming to me and say, David always tells us to speak loud, So that's why I'm so glad you are part of this program. I mean, it's not like you work only one little thing. I'm just working on my legs and my face. I mean, Jackie's, when she does things, and I from just talking to her from time to time, she targets cognition, they target the voice. I mean, that's all part of this, the program. But let me, we're kind of running out of time again. Let me touch on the cognition, because you mentioned about the processing, okay? As we age, we all get a little bit more forgetful. We go slowing down a little bit, and we all have some cognitive issues. You feel like, gosh, I'm just, I can't think as fast, and I'm forgetful, and I can't think of the words. But it seems like from reading the literature, it may be a little greater version of that in people with Parkinson's if they do have issues like that. And it tends to be these complaints when it comes to language or cognition. I'm not saying everybody, I'm just saying people, if they do experience it. Concentration, it can be an issue. Decreased concentration, they can't maintain their focus to read a book. They used to be avid book reader. They just can't concentrate enough to watch TV program. Concentration is one of the most common complaints. Multitasking, that comes down to part of the attention issue. I can't talk and do something else simultaneously. Divided attention could be. And obviously the speed of processing, the short-term memory, the decision-making, and planning something, especially say if you're cooking, it's something fairly involved, a lot of the ingredients, a lot of steps, and people just find that so hard to, it can be hard to do. There's too much going on, too much planning involved. So they tend to be the common complaints from people with Parkinson's. Language, some people complain about, you're talking about hesitancy, but going along with that, it can be, they may call it a tongue tie, or they may just, I can't think of the words, or the sentences are getting shorter, and things they're talking about is a little more superficial. Not as, can't have an in-depth conversation, it's a superficial kind of a conversation. These are some of the symptoms, the language issues. Memory, that's another big item. Especially short-term. There was like, well, I don't have trouble remembering when I was, elementary school. Yeah, the long-term memory tends to be better preserved. It's always the short-term memory. What I did last week, yesterday, and things like that. The short-term memory is one big area that we have people coming to work with us, and we may try to teach them some compensatory strategies and things like that to help them to be able to manage. Where do you draw the line? Like I said, aging, we all have memory issues. It's when it starts impacting the quality of your life. That becomes an issue, right? And it impacts your safety judgment. That becomes an issue. When it impacts your paying the bill on time, you're putting in an extra zero. You have the decimal point in the wrong place. Things like that, it really impacts the quality of life. That becomes an issue, really. People should be more mindful of. Any questions? I put down our phone number. You don't have to call our number, but like I say, talk to your doctor, and if you have any therapy specific related, you're certainly welcome to call and ask for therapists. Jackie, David, and they're all good resources, and we can continue the dialogue even after this. How many of you think it's the other person's got a hearing loss? It's their problem. I'm yelling, I'm speaking loud. There's a reason for that. That's partially what this Lee Silverman voice treatment addresses. It's not just so much you are speaking softer, and there's underlying reasons for that. I'm not sure, like, if you're talking about the protocol, like as soon as someone is diagnosed, then we follow these protocols. I can't speak for that, but I guarantee you, at least, we work with a lot of Dr. Hinkle's, Dr. Malone's patients. I guarantee you, if you say, my voice is getting softer and it bothers me, I'm having trouble with, I guarantee you, they will send you to us.
Oh, yeah.
And but this, the purpose of this is to make you being aware of it, and also make you say, okay, I'm opening up. Anytime something on my mind, I feel free to share with them, and they know what comes next when you bring these issues to them. But I'm not sure, as far as from their perspective, and you say, what timeline? Is it 3 months? Because everybody's different. You say, I'm doing totally well, I don't have any issues, versus someone saying, oh, sorry, I can't tell. So, you have to be more aware of these and bring it up, talk to your caregivers, your providers, and just, they will know how to respond. Okay, well, thank you very much. And I certainly hope that you have learned something.